in our preclinical studies, what we saw is between a 300 and 350% improvement in range of motion as early as 2 weeks after surgery. Let's talk about a common procedure. So most people know someone who has tore their Achilles tendon, whether it was Aaron Rodgers or your uncle that was playing football during a weekend game or something like that. So whether you're a weekend warrior or Aaron Rodgers, this complication is pretty common. But what happens typically is after surgery, you have months, 6 to 9 months in the case of Achilles, of pain and stiffness that you have to overcome or go to rehab and try to restore your motion and regain your function. What we do is elegantly simple. It's a complex problem, but it's a simple solution. We just apply the gel. So we have a gel that we deliver through a 2-component mixing device. So basically, we have 2 glass cartridges we put into our device. We put a plunger in, and then we apply onto the tissue as the last step of surgery. So just coat the tissue, and then close up and finish the surgery as you would regularly. And what happens is our gel stays around for a couple weeks, and that's long enough for it to protect the healing tissue and allow for the tissue to heal on 2 different planes. In other words, they're not going to stick together and cause adhesions or scarring, which is what's complicating most recovery processes. So in our preclinical studies, what we saw is between a 300 and 350% improvement in range of motion as early as 2 weeks after surgery. So we think that this can, when it translates to the clinic, which we'll be getting there soon, will mean faster recovery, less pain and stiffness for patients.